And then if you take them all out and now you lay down again, that just feels so uncomfortable. So how many of you have a hard time sleeping? Wake up in pain, hip hurts, shoulder hurts, neck hurts. If you're a side sleeper, I've got a great suggestion for you. Use lots of pillows, maybe some towels. So I'm going to show you how. Basically, your body has contours, all right? Sometimes your beds don't exactly contour to your contours. So we need to add in some pillows and fill in some space, okay? So I'm going to show you what I suggest on that. So a lot of people, they've got, a couple pillows. Sometimes they're too thick. Sometimes they're not enough. Let's figure it out how and why. So, all right, select it right there, right now. The pillows are kind of under my shoulder. Okay, that's first is a no-no because there's nothing under my neck. I can get my hand under my neck. I can get my fist under my neck. No problem. So first of all, we got to get the pillows out from under the shoulder, okay? So it just supports the neck. Now, if you've got too many pillows, say for instance, if I got 2 or 3 or 4, all right, I don't know if you can see this, but my head's kind of tilted upward a little bit, maybe. All right, so that's too many. You don't want your head up like this, but you don't want your head down like this either, okay? You want to really try to keep that spine, your neck, your vertebrae in a neutral position. All right, pillows out from under the shoulder, okay, and your neck in a neutral position. I think without looking in the mirror and just feeling what this feels like, it feels like my neck is in a pretty neutral position right there. So, and now I can't get my hand under my neck because the pillow is up supporting my neck, okay? So they do make contoured pillows, where they looks like a wave or something. Those are all fine and good. It just depends on the size that you get and where you place that. So I'm going to teach you the principles, and you get the equipment that fits those principles. So you want support under the neck, okay, to provide support to the neck, the contours. You want your head in a neutral position. All right, so we're taking up the gaps. Okay, so now most people have kind of wider hips than they do waist. So what happens is now my low back is curved like this. All right, so now I'll wake up and either my back down here is going to be hurting or my hip right here is going to be hurting. So you got to fill up that gap right there to support. Actually, it's not a gap. You got to lift it up to make your spine in a neutral position. So what you get is you can get a towel, and it doesn't have to be thick, and you got to play with this. You want to get a towel. You don't want it really thick because you want to fit it between your ribs and your pelvis, and there's not a lot of space right there. So you place that there. It's kind of like putting a little speed bump under there, okay? And it doesn't have to be thick. I feel that support right now already. And so now my spine is in more of a neutral supportive position. Sometimes you have to play around with it. All right, there we go. Good position. Okay, so now the other thing to look at is the height of my hip compared to the height of my knee. Typically, hips are wider, so you're getting a downsloping to your knee right here. Well, what that does is, again, it pulls on the waist. It pulls on your IT band right here, your iliotibial band, and you can wake up with pain in the hip. So now we get more pillows. You got to invest in some good pillows. You put that there, okay? Now, the wider my hips, the more pillows you want in your knee, between your knees. So this one's not too bad. I don't have super wide hips, so the one pillow, now my leg seems to be fairly parallel to the ground. So that helps take care of this tension on the IT band and on my waist. But now I have a gap kind of down by my ankles, okay? Anytime there's air, you want to fill that air up. So now I get another pillow, put down there, between my ankles, between my feet, just fill up all the gaps, feel like you're being supported on a cloud. That actually feels much better right there, right now. But oftentimes I'll wake up and I have shoulder pain here. So I need something it's just kind of hanging here. It doesn't feel real comfortable. It feels like there's a lot of pressure on it, just hanging in space. So I get another pillow, and you put there. I think I need another one too. So you can just kind of play around with it. You get that up there. Now my arm is supported. Okay, get it up under my waist. Just something like that. Now, it's time to go to sleep. So there's your posture when you're sleeping on your side. Now I guarantee you get all these pillows. What I got? 1, 2, 3, 4, 5, 6 pillows and a towel under my waist. Okay. You put all those in there, all right, and then you just lay down there for a little bit. You're gonna feel really supported. And then if you take them all out and now you lay down again, that just feels so uncomfortable. Wake up with a whole lot less to no pain, and it'll feel fantastic. So that's great sleeping posture when you're on your side. Just invest in some pillows. I actually prefer feather pillows if you're not allergic. Those do really well because you can fluff them up, give them a little thicker, or you can thin them out for different size that you need. So there you are. Sleep well. Sweet dreams.